Hello, thank you everyone, and welcome to today's program. When My Time Comes, the Q&A session with Diane Rehm and Joe Fabb. My name is Tom Quash. I'm the Chief Marketing and Program Officer at Compassion and Choices, and I have the honor of introducing today's panelists and moderator. Hopefully, you have already taken advantage of the documentary available through the streaming service, offered by PBS. But if not, here is a link that you can see on screen to where you can download the documentary for free. There is also a companion book, When My Time Comes, also by Diane Rehm, and you can get a copy at your Amazon or your local bookstore online. Before we get started today, please note that today's webinar is being recorded. Please also note that everyone is on view-only mode. This means that both your audio and video functions are disabled, and neither will appear in the recording. Now, to ask a question of today's panelists, type your question into the Q&A box on your screen, and it will allow you to send a question directly to the moderator. We will answer as many questions as we can during the designated time. And now it is my pleasure to introduce today's panelists. Excuse me here. Sorry about that. Oops, sorry, a little problem here with my screen. Some apologies. All right, my apologies. My apologies, Marcy, I'm getting stuck here on the screen. All right, let me. Oh, my apologies, my computer is frozen. Just one moment, please, and I will be able to get my screen shared.
While we're waiting, I know that a number of people asked for the link again, Tom. So I'm just posting that in the chat box so that people have an opportunity to take a look at the link for how to watch the film When My Time Comes. And in a moment, I'm going to put a link to the book as well.
And I can go ahead and introduce myself, and then maybe we'll do the introduction of, I'll go ahead and give my opening remarks and give the introduction of Diane and Joe. I'll let you do that, and Corinne afterwards, Tom.
I am back online, so my apologies. My apologies, everyone. First, I'd like to introduce Diane Rehm. She's a native Washingtonian who began her radio career in 1973 as a volunteer for WAMU 88.5, the NPR member station in Washington, D.C. Years later, still with the station, she began hosting the Diane Rehm Show in 1984, which grew from a local program to one with international reach and a weekly on-air audience of more than 2.8 million. Diane has received many honors and awards in her career. Among them, in 2010, Diane Rehm won a personal Peabody Award, and in 2014, President Barack Obama presented Diane with the National Humanities Award. Diane now brings her unique mix of curiosity, honesty, intimacy, and nearly 40 years as host of WAMU and NPR's The Diane Rehm Show to the podcast world. You can listen weekly to On My Mind for Diane's conversations with newsmakers, writers, artists, and thinkers on the issues she cares about most. You can hear the podcast through her website, www.dianerehm.org. The new documentary, which we'll talk about today, When My Time Comes, which is now streaming on PBS, depicts Diane's exploration of the issue of medical aid in dying in 10 states and Washington, D.C., with New Mexico being the most recent when the governor signed the law in April 8th. It is an option that John Rehm, Diane's husband of 54 years, wanted before he died in 2014, but could not have. Also honored to have with us today is Joe Fabb. Joe is an award-winning documentarian with more than 30 years experience creating personal, emotional films. He is known for his in-depth interviewing and strong narrative skills. His feature documentary, Paperclips, enjoyed a successful theatrical run and was broadcast on HBO, earning a National Emmy nomination in 2004. Joe also produced, co-directed, and wrote the feature documentary, Bedford, the Town They Left Behind, released in 2009. Joe is the director of When My Time Comes and has also been active with Compassionate Choices for several years and is currently an action team leader in the state of Virginia. Today's moderator is Corinne Carey, our senior campaign director for New York and New Jersey. Prior to her work at Compassionate Choices, Corinne spent 8 years with the New York Civil Liberties Union, most recently as Assistant Legislative Director in the Albany office. She also ran a campaign to pass women's equality legislation and worked with sex offender and reentry issues with Human Rights Watch. Today's program is hosted by Compassionate Choices, and Kim Kalani is the president and CEO of Compassionate Choices, where she has had a leadership role in authorizing medical aid in dying into 6 new jurisdictions. She also launched the Finish Strong initiative, which includes a book and a suite of resources and tools, all designed to empower patients to take charge of their final chapter of their lives. Kim is frequently invited to speak at conferences, testify before state legislatures, conduct policy briefings, and serve on committees as an expert on end-of-life care options. It's my pleasure to now introduce you to Kim Kalani.
Thanks so much, Tom. It's really an honor to be here today. And it's not a surprise that this webinar is so popular because, of course, our headliner is Diane. And so many of us have spent decades listening to her authoritative voice for years, engaging us in compelling discussions. And how fortunate it is for our movement to improve care and expand options at the end of life that Diane has chosen to use her authoritative voice to bring our issue to life. We really, Diane, are just so grateful to you for all that you have done. We are also grateful that you were smart in your selection of producers and that you came across the passionate producer of Joe Fabb to bring your vision to a reality. Joe is not only talented in producing and using film to bring an issue to life, but he's also extremely committed to this issue. And it is our honor that he serves as one of Compassionate Choice's many volunteers. Not surprisingly, Diane's prominence in this movement means that there are faces on this webinar that are new to us. And that is really exciting for us because this is a citizen-led movement and it is with people coming on board and getting involved that we are able to continue the tremendous progress that we're making. So I'm going to just spend, I know the focus of today is on Diane and Joe and the movie. I'm going to spend like 2 minutes giving you the Cliff Note version of who CNC is, and then turn it right over to Corinne so that we can get to the discussion about this fabulous movie. So Compassionate Choices, and those of you who already know who we are, go ahead and start putting questions in the chat box because that will allow us to get the conversation moving faster as soon as I'm done. For those of you who are new to us, Compassionate Choices is the oldest and the largest and most active national nonprofit that is about patient-directed end-of-life care. And our goal is for everybody to be able to chart their own end-of-life journey, no matter what that is. And we do that by focusing on 3 priority issues. The first issue is the topic of today, which is advancing medical aid and dying laws across the country. The second one is about reducing disparities in end-of-life care and planning for vulnerable populations. And the final one is about transforming how people with dementia die so that people understand that they are able to take steps right now, and also so that we help ensure that the medical community is more supportive of people's preferences given the current laws that are in place. So those are our three primary programs, but the overarching goal is to help to ensure that people are able to chart their own end-of-life journey and finish strong. In terms of medical aid in dying, we have been at the forefront of advancing medical aid in dying since the very beginning. And I think back to when Diane first got involved in the movement, and it actually coincides with when I first started getting involved in the movement, and it was back in 2014. And when Diane first started to talk about these issues in a more pronounced way, there were only 4 states that had authorized the practice of medical aid in dying: Oregon, Washington, Montana, and Vermont. It wasn't an issue that most people wanted to talk about. In fact, it was considered rather radioactive, and you could guarantee if you started the conversation that you could clear a room within minutes. But that did not deter Diane Rehm. She took on this issue with gusto and with courage and with steadfast support. And with her leadership, along with many, many others, and the work of Compassion and Choices, we have made just tremendous progress. We now have 1 in 5 adults living in a state where the practice of medical aid in dying is authorized. And as Tom noted, just last month, we got our 11th jurisdiction, which was New Mexico. But it's really important that people understand that authorizing medical aid in dying is not just about the few people that will choose the option, because it is a very few number that will choose it. It is about establishing that the patient has autonomy over their end-of-life care. And that transforms the way doctors and patients start thinking about the end-of-life experience. I can think of no better moment than right now for when my time comes to have been released. We have the momentum of the New Mexico win. We've had a devastating year with the COVID pandemic, where we demonstrated the fragility of our lives and the importance of how one dies. And there are still 4 out of 5 people who live in a state where they do not have the option of medical aid in dying. We absolutely need the power of the media to lift the voices of terminally ill Americans and continue this necessary conversation. And through Diane's infallible investigative and interviewing skills and Joe's incredible direction and production, When My Time Comes is a gift to this movement at just the right time. And for that, I am tremendously grateful to Diane and to Joe, and I am delighted to turn the conversation over to Corinne so we can all have a discussion about this amazing gift. Corinne, take us away.
Thank you so much, Kim. And thank you, Diane. Thank you, Joe, for being with us today, and to all of you in the audience for joining us today for this discussion. We've seen a lot of questions in the chat box about individual care, about the status of medical aid in dying in your own states. And I just want to direct you to some of the resources that we've shared in the chat box and will continue to share in response. But Diane and Joe, I want to start out by saying, what a beautiful, beautiful film. I mean, it just captures every issue, every imaginable issue that I've heard as a campaign director in New York and New Jersey around this very important issue. I have a few questions I'm going to bring to you about the film, both from the chat box and from Facebook. Diane, after talking with a Maryland lawmaker who watched his mother suffer at the end of her life, you said in the film that you were left with this feeling that everyone is one bad death away from supporting these laws. And do you think lawmakers who haven't experienced a difficult death of a loved one are at a disadvantage when it comes to making up their minds on medical aid and dying legislation, can they have the same level of empathy as those who have experienced this?
I hope so, but I was actually quoting yet another legislator. It didn't come from my brain. I thought it was a wonderful quote to use, Corinne. And I do think that the other thing that our legislator said was that he did not believe that he, as a lawmaker or as a son, had the right to determine when his mother's life would end or anyone else's life should end. And I do want to correct one tiny thing that Kim said. I did not seek out Joe. Joe sought me out, and I am so fortunate that he did. He called me on the phone. He came in. We talked. He told me what was in his heart and mind. And before that conversation ended, I walked with him to the elevator and I said, Joe, I'm in. So I just wanted to be clear about that because I don't think I would ever have had the opportunity to be a part of this or any other film had Joe Fabb not come to me.
Oh, thank you for clarifying that, Diane. It makes sense because you can see his commitment to this issue through and through in everything he does.
So Joe, my next question is for you. How did you come to learn about this issue and become involved? What brought you and Diane together aside from you picking up the phone and making a call?
Well, let me be one more person offering a thank you. Thank you to all of you for asking me to participate today. And thank you for the nice things that several of you have been saying about me. I appreciate it. I lost 3 close family members, both parents and a sister, in the space of 5 years, beginning in 2009. And I had been thinking seriously about doing some film about end of life or about aging. And when those 3 deaths occurred, fortunately, none of them were prolonged. However, like the legislator said to Diane Rehm, the closeness of the immediacy of those deaths and the potential that they could have been prolonged and they could have involved more suffering than they did, that had a huge impact on me. And I had been aware of medical aid in dying. I was no expert by any means. I was only vaguely aware of it. But I looked into it and it became something that I could tell it seemed to me needed. There's the wonderful film How to Die in Oregon, but that was really almost the only thing I turned up when I did my due diligence to see what other films were already out there. So it seemed appropriate, it seemed needed. It was something that now I was beginning to feel very passionately about. As one of the millions of people who listened to Diane on her radio show, I had heard her talk a bit about medical aid in dying. And then I became more aware that, yeah, she was very, very passionate about this. So I knew she wasn't going to be able to do something while she was still doing her radio show, but I like to say that I was essentially lurking in the bushes, waiting for her to end the show. She did at the end of 2016, and I pounced. It was really what she just described to you. It is the way it happened. We had one meeting, and and she immediately signed on, which shocked me. But that's Diane. You know, when she's committed, she's committed. And so, as we were talking about before we began this conversation with the audience, we had a remarkably wonderful 3 years making the film that was really joyful despite some of the things we were encountering along the way.
Thank you, Joe. Diane, I was so impressed by the restraint that you showed when talking to those who felt that with excellent palliative care, no one has to die in pain. Frankly, the statement so clearly contradicts the experiences of so many people we hear from. Can you speak to how you handled those interviews with people who raised objections like that?
Well, we knew from the beginning that this would not be a film widely accepted or even understood unless we brought in those voices who really had very strong and, to their thinking, very reasonable points of view objecting to medical aid in dying. For example, a Roman Catholic priest who told us that the Bible and the words of God prohibit someone who has used medical aid in dying or is using medical aid in dying from having last rites. And that really did trouble me, but I understood that from his deeply felt religious convictions, that's exactly the way it should be. He explained that if a Roman Catholic individual decided simply to stop using any kind of medication or medical assistance, then last rites would be allowed. But the moment any action was taken to begin the process of ending life, then the church felt very strongly against it. And a doctor in Oregon who was totally against Oregon's right to die law from the beginning explained to me that his feeling was that the doctor's role was simply to move along with the patient, to be a companion with the patient as he or she moved toward death. I could understand that without taking it into my own way of thinking. I could simply accept that there were different points of view, as there have been for the 40 years that I did the daily radio program. We always had points of view that were different from not only mine, but the guests themselves. So I think I just understood without agreeing or disagreeing. I just understood. And that made it possible for me to accept and move along.
I understand that. Joe, I guess this is a question for both you and Diane. The artwork that highlighted the topics in the film, I noticed that from the get-go, and I just beautiful. We have a couple of questions about how you decided to highlight those paintings. I'm curious about the artist. I'm curious about getting permission to do that. Can you speak to the artwork that you highlighted in the movie?
Sure. I'm so glad to have that question because it gives me a chance to compliment our editor, Barbara Ballo. We knew we needed and wanted some kind of a visual kind of both to underscore some of the thoughts, but to back up what Diane had said at the beginning of the film, that death is something that people have been trying to deal with as long as there have been people. And Barbara came up with the idea of using the artwork that you see. In terms of rights, almost all of it was happily in the public domain. And the few items that were not, when we approached the artists, they were very, very gracious and gave us permission to use them.
And you know, Corinne, it's really interesting that we began and ended the film there at the Phillips collection. And that building, that art collection, was the very first art gallery that my late husband, John Rehm, had taken me to. So it really, for me, was a very powerful choice. And I'm so glad Barbara chose the painting she did. And I think she did an absolutely wonderful job of singling out those paintings that had so much connection to what we were talking about in the film.
So glad I asked that question. We've got a lot of questions about medical aid and dying itself, a lot of questions about different conditions that people have and the arguments against it. But I'm going to use the privilege of the moderator to ask one more question about the structure of the film before we get into those issues, just because I found it, I've used the word beautiful before, but it really was. And for folks who are listening to this Q&A, if you haven't seen the film yet, please, you really should. It's the best use of an hour of your time. One of the technical aspects of this film that I found so interesting was the juxtaposition of filming before and I think during COVID. I could be wrong about that, but we see you, Diane, sitting close to others and talking to them intimately. And then we see you interviewing people about equally intimate subjects over Zoom. And was it difficult to get that same level of intimacy? Do you think this experience, Joe and Diane, will change documentary filmmaking in any way?
Well, I'll speak from the personal point of view, and Joe can speak from the professional point of view. I was out on book tour at the beginning of 2021 because the book I wrote is based on the film, but came out earlier than the film did. And I was on book tour from January until March when everything shut down. And from then on, everything I did to promote the book and the forthcoming film was on Zoom. Now, during our filming, we certainly had to use Zoom. When we spoke with my high school sweetheart, Bill Roberts, who was out in Colorado, we had already been out in California, in Oregon, in Massachusetts, in other areas. But doing Zoom somehow has created, I think, an even more personal connection, because as I look at Joe's wonderful office and see behind him that wonderful paperclip poster and photographs on his wall, and see him very comfortably in that place, I get a sense of who he is. And we did that, I think, with several of our guests. And I felt it worked quite well. In fact, for my podcast, I have been doing that now since 2017. And for the book club we use podcasts. So everything seems to work quite well, I think. Don't you, Joe?
I do. And, there's sort of a institutional resistance to using Zoom or other similar applications in filmmaking. It's considered, or was considered, either cheating or cheap because you're not traveling to wherever your guest is. But I agree with you. I think that one of the things I learned was that no, that's really not how it is. And but to answer part of your question, Corinne, we had finished filming before the pandemic began, so it wasn't an issue that came up in that way for the film.
We were very lucky to have finished just
We were extremely lucky, because it wouldn't have just been shooting the film that would have been affected. There's a lot that happens after you've filmed, and much of that we did do during the pandemic. But I couldn't go, for instance, I didn't go to the post house as we re-edited the film for PBS at all. I didn't go, not even once. And typically I would be there for days on end, sitting with the folks doing technical work there. There was something else. But the interview that we did the first interview that we did with Dan Diaz, Brittany Maynard's husband, is on Zoom. And that was before we had figured out that Zoom wasn't so bad. And Dan helped us understand that. We interviewed him while he and his family were on vacation, I think in the Dominican Republic somewhere. And it was like, well, that worked great. So then when it came time to interview Bill Roberts, we didn't even have to think twice. And we've gotten better at one of the tricks was getting people on the other end to be able to use their computers to do this with us. But it seems like everybody's had to learn that now.
Yeah, I have to say it's opened up the ability of some of our terminally ill advocates to speak with lawmakers. They were never able to travel to state capitals in the past, but opening up this avenue, and talking to people from their beds, it's made this issue more real for lawmakers in some ways. Not
Corinne,
that they're, yeah.
I'm sorry, finish your thought, but I wanted to toss something in.
No, I just, not that there is any bright spot to a global pandemic, but, it certainly has changed the way that we think about in-person interactions.
Absolutely.
For sure. I'm stepping over a line here, but you used the moderator's prerogative a minute ago, and I'd like to use the panelist's prerogative if I could. And I saw a question from Judd Richland in the Q&A, and he's pointing out that opponents in medical aid and dying are skilled in using language to frame the issue in a negative light. And the reason I'm butting in is because that's a huge one to me. He says, talk about the importance of language in describing medical aid and dying. We, of course, had to make sure that we learned the language and that we understood the languaging issues when we were making the film. I mean, it would be very easy well, Diane was the one asking the questions, for some phrase or something to slip in there. So we did our due diligence about that. But I find it to be one of the personally, to me, the most irksome issues. I don't want you to go look at this, but I'm going to mention that there was a column written in the Federalist about the film. And the person who wrote that column persisted in using the word suicide and the phrase assisted suicide. Of all the things in that piece, I think that's what bothered me the most, because he knew that he mentions that we use the phrase medical aid in dying. He didn't say why. He didn't make the important distinction between suicide and medical aid in dying, that those committing suicide have no option to keep living, and that those who choose suicide have the option to keep living and they choose not to, and those who choose medical aid in dying don't have the option to keep living. They're just managing as best they're allowed to, if they're eligible, how they're going to die. That is so critical to me, and it just irritates the heck out of me when I see somebody persisting in this use of suicide, because to me now it becomes a political statement. And we try very strongly, even though Diane interacted with legislators, which is critical to what's going on, we tried very hard not to be in a political space. We're arguing, as CNC is, for autonomy, patient autonomy, which should not be a political issue. So I just need to get that off my chest. So
Well,
thank
Joe,
you for letting me.
you must have read my mind, because that was actually the next question I was going to ask, and I appreciated it.
Good.
Because it hits on another question that we're being asked here, and that's about the disability rights community. Language is so important. We've actually learned, as a senior campaign director in New York and New Jersey, I've learned that the term dignity is loaded. When you say that someone is experiencing a loss of dignity, there are those in the disability rights community who take great offense at that term. And so I guess I wonder, for both of you, it's been portrayed that the disability community is against this law. We know that that's not true. We know that there are disability rights organizations that share our values of autonomy, self-determination at the end of life. And I wonder, can either of you speak to, and maybe Kim also, the fact that there's not been a single incidence of a problem? I mean, the fears that people had about disadvantaged communities, people living with disabilities, folks with difficult to manage medical issues being taken advantage of with these laws, those are the same arguments that were advanced over a quarter of a century ago, and they have not come to pass with any of the laws in the 11 jurisdictions. How did you deal with that in the filmmaking process? Or Diane, and you're speaking about this issue.
Well, I can give you the response that Mary Chey, lawmaker here in Washington, D.C., who sits on the district city council, she told me that it was very interesting to her that about half of the disability community was totally against medical aid in dying and passage of that law here in Washington, D.C. And the other half came to her and said, why aren't we included? Why are we left out of this when, if we want to have choice, why can we not have choice? And Mary Chey said that it was a step too far, both that and dementia or Alzheimer's disease. Both communities reacted in both positive and negative ways. And of course, I'm sure, Kim, you can add to that, but I think as you have told me, for example, it is those who are afflicted with ALS who are among the highest rate of users of medical aid in dying.
Yeah, Kim, I was going to ask you to speak to this because whenever this topic comes up in a public forum, questions around dementia, Alzheimer's, and ALS are among the first that we're asked. How do you address some of the concerns that people have about their inability to qualify or inability to use medical aid in dying because of their inability to self-ingest the medication or make a contemporaneous decision?
So with ALS, most people are still mentally capable. And so it's more of a misnomer. There are multiple different administration routes. The person has to be able to take an affirmative act that they are the ones that are consciously making the decision. And so if people have lost the ability to swallow, they can use a rectal catheter or a feeding tube. So the second largest percentage of people who use medical aid in dying are people with ALS, next to cancer. And so, very small numbers of people have cancer, but large numbers of medical aid in dying users, have ALS, but large number of medical aid in dying users have ALS. So that's ALS. The dementia Alzheimer's is entirely different. All of the US laws do require that a person is mentally capable, terminally ill, and that ability to self-administer themselves. And it is the core safeguard that allows the legislation to move forward and to assure that there is not abuse or coercion. And in a country like the United States, where you have systemic inequities in our end-of-life care, and there isn't nursing home care for seniors, you don't ever want someone to have to make the choice between care and death. And so you have to balance the autonomy aspect of it, which is so critical, with the need to be people with quality end-of-life care. And so the law as it's fashioned now allows us to firmly establish that the patient is in charge of their end-of-life care because there is mental capacity that's there, and because it's tied to hospice care, which has a 6-month eligibility requirement. And that's what allows you to balance the equity and the autonomy aspects that are so important. However, it is a misnomer that there's nothing that somebody can do if they want to prepare for a dementia diagnosis and do not want to prolong their death. And so I did put in the chat box our dementia values and priorities tool. I encourage people to look at that. It can take you years. If you do not take steps, you will live with a dementia diagnosis for years, where medicine continues to treat you as if the goal of care is the extension of life. And so if you do not want to live in a state of dementia for years beyond that, you can shorten the length of time that you live with dementia by years by taking steps to indicate that you do not want medical treatments if you get other diseases. And by the time people have dementia, the vast majority of people have something else that's wrong with them: heart disease, cancer. So you can not take medications for those things. You can allow things like pneumonia to end your suffering peacefully with palliative care. And so people are living for 8 to 10 years because medicine is intervening, and we can really shorten that process if you take steps. And I would encourage you to use the tool, to find a supportive health system, to document what you want in a video. All of those steps are essential. And Compassionate Choices is going to continue to make sure that people's legal right to forego treatments and to have a more compassionate end when they don't have mental capacity, like with dementia, that we realize that is something that's, recognized within medicine.
And that is why at the very end of our film, or toward the end, I asked my grandson to turn on his cell phone to video record me as he was being videoed by our videographer, as I stated to my children, my husband, my doctor, exactly what I don't want at the end of life. And should I begin to experience signs of dementia, I ask them all to let me know. And I presume I will have a sense of that. I'm 84. I feel very strong, and I feel as though I have my wits about me now. But should that begin to change, I have asked my family to honor my wishes and let me know, because I do not want to live for those long years that Kim is talking about. I think I have seen so many individuals live out their lives that way. And, you know, for some, they say, well, he or she is just fine. And that's totally their choice and should be. It's not my choice. So, Joe, I'm so glad we included that at the end of the film. I think it was so important.
And so
Thank
many
you.
people have observed that in
Yeah.
the film and have commented on it. I've had questions from many friends saying, is that really something you recommend? And yes, of course. The difference between having a piece of paper shuffled around between family members and doctors and so on versus your face and your voice saying, hey, this is what I want. And I don't remember if you did this, Diane, but um, the what was it that you read to us?
It was the wife of, it was the
Daughter
Lindbergh.
of
It was Reeve Lindbergh's mother who had left, and Reeve found this after her mother died. It was a paragraph she had left in a book, and I read that paragraph into the film because I found it so meaningful and exactly how I feel.
and it speaks straight to caregivers, hospitals, whoever might be in the position to have it shown to them that the person speaking on the video is charging you. Don't you be changing my plans for me, which on paper doesn't always work.
This Q&A just went by so fast. I do have a closing question for the two of you, but I just want to also share with you, Dan Diaz, Brittany Menard's husband, is on the Zoom today, and he wanted to convey Brittany's appreciation for you. Dan shared that Brittany and he watched on the PBS NewsHour Judy and Diane, and they sat next to one another on the couch in that house in Portland back in 2014 before she died. And Dan wanted me to share with you, Diane, that Brittany said, we need more journalists and radio personalities like these two ladies. In a media environment where obnoxious men are constantly shouting at one another just to drive their ratings, it's nice to see these two deliver the story without all the bluster. So I thought you might appreciate that.
Thank you, Dan.
So my last question for you before we close up is, I guess for all three of you, Diane and Joe and Kim, what do you hope to see happen with this documentary? What are your wishes?
My hope is that people who see it will begin the conversation. And by people, I mean everyone. I mean fathers, mothers, children, doctors, lawmakers. It's so interesting because apparently younger doctors, those being trained now, are more open to the idea of medical aid in dying, whereas those who've been in positions of authority as doctors for a long time are not comfortable with turning that authority over to the patient. Well, it's the same with medical aid in dying. The fact of the matter is, unless all of the people on this call, including each of us, talk to not only the people around us, but write letters of support for medical aid in dying laws to lawmakers around the country, it's going to move slowly. I am so grateful that New Mexico has just passed the law, and yet we learned just today that Connecticut turned it down. And what does that tell us? It tells us that there's a lot of work ahead, that each and every one of us who believes that autonomy and decision-making should be the right of the patient, that if you believe that, we each have our work cut out for us.
Well, I certainly agree with that. Forcing this subject out of the shadows, that's what we said over and over while we were working on the film that we wanted to do. I just, I want to go back to what Kim said at the beginning, that this is just a great time to do the work that we need to do. And when I was recounting to somebody recently who said, well, you know, I told them that at that point, before New Mexico, 22% of the people living in this country were in places where medical aid in dying was authorized. I said that, and they said, well, gee, how did that come about? And, you know, how come I don't know that? And, you know, there's all kinds of answers to those kinds of questions. But what I said back to them was, think about the fact that the first law in this country, in Oregon, passed, or the referendum, I think it was, in 94, but not enacted until 97. The second one wasn't until, was it 09, 2009 in Washington State, thereabouts. What a huge gap in time. But those first two, now we have 11 jurisdictions, correct? And 9 of those came in the last decade. It's remarkable. So we've got a wave going here. Let's get on it. Let's ride it. And so I'm really happy that what we're doing has turned out to be in the right time frame, and we just have to keep going. But let me take the opportunity to express all of our gratitude to Compassionate Choices, because, geez, you know, where did those accomplishments come over the last decade? They came from Compassionate Choices work and lots of people who hold strong beliefs about the issue, but you channeled them and focused everybody's efforts. So thank you. And I'm just glad to be on board, to be working with you.
Me too.
Kim, before I turn it back over to you, I just want to say to folks, you know, this film is a perfect vehicle for starting conversations in your own communities. That if you at some point would like to, I don't know when PBS will allow us to do this, but if you'd like to host a a Q&A with Compassion and Choices staff in your own community, please get in touch with us. I posted a link in the chat about how you can get involved in the work to authorize medical aid in dying in your own state in the chat box. But what a great vehicle. We used to show How to Die in Oregon, as you referenced, Joe, but it's a very long feature-length film. This is sort of the perfect length, and it's beautiful, as we've said, and it raises all the issues. So I would encourage people to think about getting active in their own communities in that way. Kim, I'm going to leave the last word to you, and then I'll come back with some resources.
Thank you all for being here today, and a huge thank you to Diane and Joe, both for being here today and for bringing this film to life, because I really do see it as a gift to the movement. And thanks to Corinne for so eloquently facilitating the discussion today. I just want to close out by sharing the potential for this film. The potential that this film offers is to really continue the progress of this social movement. So we all know that social movements come about because citizens get involved and they demand change in some way. And we've also seen countless examples of movies or literature, film, playing a leadership role in helping to generate that conversation and that discussion. So my hope is that today you watch the film, that you encourage your friends to watch the film, and that you all decide that this is an issue that you care about, because you recognize that it is about a human right that's fundamental to who we are. We've got to live our whole lives autonomously. And now all we're asking for is to be able to say goodbye in an autonomous way. And for us to make that change a reality, for us to continue the momentum that we've had over this past decade, and to make other states have the same option that's now available in New Mexico, it takes one thing, and that's you. It takes people coming together and demanding a different end of life experience. And it takes resilience and it takes resolves, because unfortunately for every New Mexico, we have countless other states where the answer from their lawmakers was no. But we will make progress if we don't give up. And us not giving up is more people joining the cause, more people getting involved. And this movie has the potential to bring more people into this movement. And so my last final wish for you is that you go out and you get as many people as possible to watch this movie and join the movement. Because then next year, or even maybe this year, because there's still a couple of states in play, we could get 2 states with enough support. And the year after that, we can get more. And the dominoes can fall. And all of a sudden, we can have patient-directed end-of-life care. And it will not happen because of me or because of Diane or because of Joe. It will happen because all of us came together and used our voice to say, this matters. So with that, I turn things back over to Corinne. I thank you all for an engaging hour, and I hope that we see you involved in this movement.
Kim, thank you so much. I just want to let those of you who are still with us know that we have a number of events coming up. On Thursday, May 6th, the City of Hope in California is doing a webinar with us on aid in dying medication, the clinical competencies of prescribing. You can register for all of these webinars on our website. On Tuesday, May 11th, there's going to be a program on medical aid in dying and ALS, as we heard about today, how the option can ease end-of-life suffering for people living with ALS. You can learn more about these webinars and register at compassionandchoices.org/webinar series. Next slide, please. We also have an archive of previous webinars. We started doing a lot of webinars last March, and we've accumulated a number of really, really interesting programs, and I encourage you to check them out here. A lot of superstars that have done webinars with us like Diane and Joe today. You can also follow us on social media. We have a very active Twitter account if you are someone who tweets. Kim Kalani is also a master tweeter and shares really important resources. We've got all of the videos that we've done with our supporters and on our work on YouTube. We have a YouTube channel. We have a Facebook page. Some of our state campaigns like New York and Connecticut and New Mexico have their own Facebook pages. And we've also got a burgeoning Instagram account. So I encourage you to follow us on social media. Next slide, please. This is, again, Diane's lovely book, When My Time Comes. I encourage you to check it out. I'm going to make a plug for your local bookstore. So you can get it on all the major ones, but, you know, take a drive or a walk down to your local bookstore and order it. And then finally, please, if you haven't seen it, watch the film, well worth your time. And think about maybe getting in touch with us to host a screening when we're able to do that in person or on Zoom sometime in the future. I guarantee it will spark a wonderful conversation and get more people involved in this movement to authorize expanded end-of-life options. Is there another slide, or is that's it? Diane and Joe, thank you so much for your generosity in making this film, in the care with which you took in doing that, and in joining us today for this important conversation.
Thank you.
Great
Corinne.
pleasure. Thank you.
It was our pleasure. And
Thanks.
thank you, Kim.
Thank you all for joining us today. I hope we see you in other ways in our campaign, but thank you so much for tuning in this afternoon.
Thanks.